Okay, so all right, so let's get started. Once again, welcome everyone. I'm Alexandra, and I'm here today with my colleagues Dalina, Camila, and Dr. Roche. We are very happy to have you here today with us, and we hope for a very interactive session with you. Before we begin, a quick reminder. So you can send your questions at any time using the Q&A section here in the webinar or the chat. We encourage you to participate, please. The more interactive, the better. And it's my pleasure to introduce you to our host this evening, Dr. Enric Roche. He's Vascular Surgeon, Inventor of VARIXIO, and our Chief Medical Officer here at VB Devices. Dr. Roche will guide us through today's webinar and share his insights and expertise. Enric, thank you for being with us, and the floor is yours, please.
Okay, so thank you very much, Alexandra. It's for me a great pleasure to be here and to have the opportunity to share with you some details about the microsclerotherapy. And I have to confess, this is a webinar where I am open my office to you. So I'm going to give you a lot of information about how I work, some details, some materials, and some videos that can be very useful. So then we start the presentation. Okay, so then this is my okay, this is pasa. Okay, this is my disclosures.
I'm sorry. Just a quick thing. Camila, can you switch, Dalina, can you switch the screens so we can see the presentation instead of the presentation mode that is meant for you? So we can see it a little bit bigger. Yeah, I think you can actually.
Tú tienes que poner en así modo de presentación. Voy. Pero
Just 1 second, we're starting in a second.
Y ahora, tienes que ir a presentación.
sí, hay un modo de presentación.
Okay. Y me vas a tener que dejar ahí.
Y vuelta.
Perfect. Yes. Thank you.
Okay. So just a quick reminder about what we're talking about. The VARIXIO device is a VARIXIO that offer the possibility to make the foam in an automated and a standardized way. So of attendees, there is half of the attendees, they have the VARIXIO device. The rest, they don't really know. Maybe they've seen the VARIXIO in meetings, but the idea is very simple. This device consists in 2 parts, one disposable capsule and one fixed equipment. The equipment is a stirrer and the capsule is a disposable place where you put the liquid inside. Once you have decided which liquid do you want to prepare as a foam, then you load the capsule with 2 mL of foam. Then you inform the machine, the stirrer, about which drug and which concentration. And third, after maximum 1 minute, mostly 45 seconds, you have the foam prepared and ready to use to withdraw. So, but I want to point out, I'm not talking slow. I want to point out about the tips, some tips and some important messages. The first idea you have to know is that what we develop is a system that standardizes the preparation. And every time you prepare the foam with the VARIXIO, you will have around 100 microns bubbles. That's the average diameter of the bubbles. Second, in every preparation, you will have mostly between 1.5 to 2 more stability than foam prepared by manually. And afterwards, I will explain why. And finally, the liquid ratio in average is 1 to 6. 1 to 5 in low concentrations, 1 to 7 in higher concentrations. Why this foam can be, the behave is different? Because the structure of the foam, because it's drier than the 1 to 4 foam, this place has the piston effect. This is something that I'm going to show you right now. The piston effect consists in how this structure is beneficial because move and displace the blood and make easier the contact between the drug and the endothelium. Some examples that I want to show you just right now. This is two images that how can different foams offers different effectivity or effect on the endothelium. We have developed two different types of capsules. One capsule filled with air, this is the VARIXIO air, and the O2CO or low nitrogen capsules filled with O2CO2. Afterwards, we can discuss about when use one and the other capsule. But for starting, I want to show you that from now on, you have to see that this is very common comment in meetings that they say this is not possible to have foam passing through a 30G needle. So here you can see in different videos how it's possible to have really foam passing through a 30G needle, not only a 30G, but in a 32 are going to see right now that is possible. And why is possible? It's just because of physics. It's because we can make a very homogeneous and very small bubbles, uniform, in a ratio 1 to 6 or 1 to 7. The more air you have in the foam, the more stable is the structure. Here you can see a 34 needle and foam that passing through a 34 needle with a very low concentrated foam. And what about the piston effect? I'm going to show you what happens if you prepare a foam, a more or less heterogeneous foam with big bubbles or in unstable foam. What happens when you inject this type of unstable foam in a tube, in this case, where the fluid is passing through? Immediately when you inject, there is starting the structuring of the foam. And then you can see how the gas is appearing in big bubbles so that the composition is clear and easy to see. And that's what happened in the vein, in small veins or in bigger veins. On the contrary, when you are using the device, so you are using this type of foam, because of the structure, because of the stability, what you see is this piston effect. It means that once you are injecting the foam, the injecting is displacing the liquid, and because it's more stable, you can make easier the contact of the drug with the endothelium. I'm gonna open my office, as I told you, and I'm gonna explain how I work and how I have my clinic in my setting in my clinic. Afterwards, I will give you some clues about how to dilute, how I treat, immediate post-treatment and follow-up. What about the material? Some of you, if you are starting the sclerotherapy, maybe you think that you need is a non-expensive material, but you have to know that you need a lot of different material if you want to be a master doing sclerotherapy. Okay, this is a short video that I'm going to show you how I have in my clinic organized all this material. Of course, you need filters, you need long catheters, you need different type of syringes. In my case, I have at least 5 types of different syringes, plus 2 types of syringes of glass. I have 10 types of different needles, 10 including small butterflies with different numbers, 25, 27. Here you can see how can set the clinic in the clinic the VARIXIO parts, different types of pads for the exacting compression. In cases of very small varicosities, is not necessary, but if you are treating reticular veins sometimes or small tributaries, it is necessary. Different sticking pads, different sizes, and of course, one clock. Why? Because sometimes you need to control the time for to advise the rest of the patient. This is a different types of sclerosing drugs, and in cases of using mix with glycerin, you can have also the glycerin here, and you see here in the drawing also pots to make dilutions. This is the syringe, glass syringes, different sizes, bandages, etc., etc. Next. Okay. Oh. Sorry. Pasa. Okay. Okay. Another, this can be useful for you. If you need, I really, my advice is to take pictures of your patients, and instead you need a great photocall. Just you can install a curtain from the roof. You can go up and down depending on every patient, and then you always have in a very easy way the how to take your photos always in the same way. ¿Toco yo o tocas tú?
¿Lo paso?
¿Pasa? Venga. Another tip, pasa? Okay. Another tip is how to manage the control of the pictures. This is a very easy way to do it. This is no toques, por favor. This is a very way to use it with the iPad. If you are doing your pictures in the iPad, you need only to put a tag with the number of the patient. This is a number of the file of your patient, and automatically the iPad is searching the picture, and it's a very easy way, and you don't need to invest in a complex programs or waste time organizing the files. So this is very easy. Just put the patient in front of the curtain, put the tag with the data and the number of the file. Some other details that you need to take in account. We saw this is how we organize our very small table with saline, with the chloretilo is an anesthetic spray, the different syringes and different needles. And the music, why not? It's very relaxing for the patients. This is a special pillow to put the leg up in your patients. This is just for squeeze, you know. Even the sclerotherapy is painless, more or less. Sometimes patients are very afraid about needles, so this can be useful. Here, this is for preparing the glass syringes. Other magnified and other devices that help you to do the transillumination sclerotherapy, magnified glasses, etc., etc. And of course, I have to say, you need to have an emergency material. Hopefully, I've never used it. After more than 20 years doing that, never used the adrenaline or atropine, but you need to have it. if you have a problem with the patient, you get in a trouble because if you don't have this prepared in your office, you can have a real legal problem. So how to dilute? I was mentioned before that we are preparing a very, very low concentration foam. I will ask you to take your phone, please, and please take the QR code and try if it works or not. I give you 10 seconds. Once you have this QR, you will see a formula, very easy formula to prepare and to dilute, coming from the concentration that are you using, which volume are you using, and which is the final concentration you are looking for. So then automatically you will have the saline that you need to add. I say saline because I believe that it's not a good idea to dilute with other mixed drugs, especially if you are using water. Water is painful, and you are using a lot of water can cause hemolysis. So the idea is if you have the correct concentration, okay, it's much better not to dilute, because to dilute is an off-label use, and it is something that you have to include in your informed consent. So then, in your informed consent, you could explain about, in some cases, you could need to dilute the drug that is off-label use. This is not a big problem. So how I treat my patients? So my patients, first, in this case, I'm going to show you the treatment of small varicosities. I am using O2CO2 in this case. There's a place I go when no one knows. It's not first, I load the capsule with a syringe, a regular syringe, but I withdraw with glass syringes. And for spider veins, I'm using from 0.15 to 0.2. I call sequential punctures because what I notice that is much better to do small injections with a small amount of foam rather than inject from only one side or one point. The assisted technique, as you can see, this is not very typical because I am handling the needle with the right hand, and with the left hand I apply this anesthetic spray. The assisted is very, very useful because you can be very precise in the punctures. As you can see, I've never withdrawn the blood, because you directly see when you are injecting. In this case, the nurse is injecting, she really can see that if there is a lump or not. She can see if the foam is in or not. It's extremely rare that a very low concentrated foam can cause any lesion or any scar in the skin. What is common is people that has this problem, a necrosis, skin necrosis, probably is related to the use of very small syringes. The 2 ml syringes are dangerous because when you inject the foam or the liquid in the capillary, you can have a pass through arteriovenular capillaries. We will comment afterwards. So the idea is slow injections, low volume, low pressure. Of course, to have less pigmentation is necessary to adapt the concentration, but it is necessary sometimes to release the thrombus, also for very small veins. When you see this the next session, in the second session, when you see this darkening, a bit tenderness of the skin, this is, I think, you are forced to do that. In cases of big veins, also the same, in order to have a good reabsorption and avoiding the pigmentation. I am using corticoids immediately, local corticoids I apply, and sometimes I put occlusive bandage, as you can see here. And this is for two reasons. First, this is because of comfort of the patient. After the injection of big areas, patients suffer from itching or some annoying feeling that with this cream is absolutely very useful because disappear immediately. This is some cases of treatments that I can show you afterwards. All of the cases have been treated with foam. I've been using foam for the last 10 years when I started, more than 10 years when I started with this project. And what I can see is that we can comment afterwards, even there is not a comparative study between what is better, the liquid and the foam. What I can see is my experience is the foam is powerful, and you can, if you can decide to go very down in concentrations, is very, very useful. Okay, here. Okay, so let's go. This is another technique, probably is the mainstream technique, is using only you and handling only you the syringe. Why I'm using this filter? This filter is because of the stability. If you are using plastic syringes, I recommend this filter because it makes more homogeneous and more softly the injection of the foam. And some situations to whom has the foam to have the best withdrawal without bubbles. This is to optimize the withdrawal. This is the way that you can do it. Then you withdraw are very clear without big bubbles if it's necessary. This is something that can happen. Other things that can happen using the VARIXIO device is the overload. What it means overload? Overload is when when you have injected more than 2 or 3 ml, and there is. No podemos oír.
Sí, ponle aquí.
Sí. No.
¿Qué quieres oír?
Oírlo.
Ahí está full.
No, pues no. So in this case, the problem, if you have an overload capsule, the problem is that you can lose the traction, and then the withdrawal of the foam is not good. So then the best thing is to follow the IFUs and maximum inject 3 ml of liquid to get around 20-25 ml of foam if you are using mostly O2 CO2. In this image, you can see how different can be the pressure using the same force. Using the 20 ml syringes, doing the force, equal force, if you do the same force with the 2 ml syringe, the force is 5 times more higher. Next, please.
Yes.
So the idea, it is important to know that in some cases, when you are treating capillaries, if you are having an overpressure of the capillary, there is a connection between the venous and the mini capillaries. So because there is an sphincter, arteriovenous sphincter, that you can pass through using drug. That's the main reason to have necrosis when you do sclerotherapy. Using low concentrations is extremely rare to have a necrosis. the case, the main cause to have this complication is the overpressure. Next. Of course, this is an obvious thing. You need to have different sizes of needles if you are treating varicosities. Next. And this filter is very useful in case of using low quality syringes. Or if you're using the best syringe, which is the best? The best is the Becton Dickinson free silicone syringe. This is without the rubber. But if you are using the rubber, without rubber, you need to put this filter to keep more smoother injection. Next. My motto, when I treat varicose veins, varicosities, is always better to repeat the treatment than to regret a bad result. Next. Next. Okay. To avoid pigmentation, the main messages: avoid pigmentations, adjust the appropriate concentration. For small veins, use less than 0.2%, sequential punctures rather than one single point, and drain when you visit the patient in a follow-up. Next. As you can see, I showed you before in the previous video. Next. To avoid matting, start treating the feeding veins. Do not treat intensively with high volumes a small area. And if a thread vein is very resistant, investigate it with the duplex and trying to find out what is happening. Next. To avoid the skin necrosis, as I mentioned before, the overpressure of the small veins is quite dangerous. Next. About neurological symptoms, ask to your patients about the migraine. We know that the 25% of the population has a patent foramen ovale. But what we know is the incidence of the patent foramen ovale in patients that suffer from migraine is higher. So then it's very easy to ask your patients about the migraine, and in this case, control the total volume injection and keep the patient rest with elevated legs, and of course, avoid Valsalva maneuver. My advice is that your nurse or yourself help the patient to get dressed. Next. About the stocking is controversial. I know that people are using stocking for small veins, but I am not doing regularly. Sometimes yes, but in general, I think the only with a bandage for 24 hours, I keep the patients, and that's it. In some cases, it could be necessary if I combine treatment of reticular veins. Anti-inflammatory creams that I show you can be with corticoids or can be with arnica base. Next. Is logical. The informed consent registry is mandatory, and photo registry, it is almost mandatory. I would say, especially in cases of static treatment, is much more beneficial than compromising. And sometimes you could think that this is something compromising to do that, but I assure you that if you do the right way, you will have best relationship with your patients when your patient asks about the results, and then you show them, which is the starting point. In summary, my technical advice for microsclerotherapy: adapt the material and drug concentrations. Start with filling veins. small volume injection. Fill no more than 4 by 4 square centimeters. Of course, stop when you feel resistance, stop when you feel a pale skin, avoid this pale skin, and stop immediately if severe pain occurs. Photo and informed consent. Next. And that's I think is finished my presentation. Next. There are some cases with different veins, with different sizes in different patients. Next. Ves pasando. Next. Next. Ves pasando. Next. And you can see that there are different patterns of varicosities. Next. Next. In all cases, I've been using the foam as an only sclerosing agent in different concentrations, but always less than 0.2%. Next. I think we finish in summary. Next. This is our own series, but this is our own series is an almost 90% of between 75 to 100% result success, only with a 5% of residual matting. Next. In summary, once again, my motto in aesthetic treatment, always better repeat than to regret the bad result. Select the correct material and adapt to each patient. Always informed consent, be realistic, manage the expectations. And if you are using VARIXIO, it's very important to know that VARIXIO foam is more powerful. So then think in concentrations. Thank you very much for your attention. And I'm very, very sorry about the technical problems. I hope we have now the option to talk and to discuss.
Thank you, Enric, for the presentation. Yeah, let's hear some questions. I see one question here in the chat that is, we need to use 1 capsule per patient. Is that correct? Yes.
Correct?
Correct, yes. We want to avoid any cross-contamination between patients. The capsule is sterile. Yeah, we don't want any contamination between patients. And Hillary Hurley is asking, any chance of foot pedal self-controlled delivered injection? That's interesting.
Okay.
What do you think about it, Enric?
I don't really understand. So Hillary, the foot pedal self-controlled delivery injection, I don't really understand the question. So my view, pedals, okay, but pedals control delivery, I don't really understand what you mentioned. If you regarding the movement of the movement of the ankle or what? So what I would say is I'm doing a lot of sclerotherapy around the ankle. And I don't know, Hillary, can you explain more in depth what you mentioned? What do you
rather than assistant, you have a foot pedal to control delivery. No make apples. So yeah, I understand a little bit like.
Yes, Hillary, maybe I got it. This is not a foot pedal control the delivery. Or what I mentioned before is my technique is an assisted sclerotherapy, assisted by my nurse. So I am always using the assisted sclerotherapy because it's more precise. My nurse is with me, and my nurse is injecting, is pressing the syringe that is connected with the needle. I have my needle in my right hand, and then I can be more precise. Once the nurse can see that the foam is not in place or there is a small lump, then she stops injecting.
Yeah, I understand, Hilary, that instead of having an assistant that delivers the foam, you actually control the delivery by a foot pedal. That sounds quite interesting.
Yeah.
Next question.
Yes, I see. Just for confirmation, no compression. No, exactly. So I'm doing not regularly compression. I am applying a bandaging, but in small varicosities, this is not a common practice to use compression with stocking. Regarding the maximum volume, if my average volume per session is around 9 to 10 mLs per session in case of varicosities. In patients full of varicosities with big veins or big areas, after my first treatment, if the patient have a good toleration, then I can go to up to 15. But more than 15 is extremely rare in case of spider veins. In some cases, what I could do is asking for migraine, I'm using O2CO2. And in those cases, because of if the patient suffers from migraine, I control the volume using O2CO2. In cases of big veins, great saphenous veins, small saphenous veins, tributaries, malformations, if I have to inject more than 15 mLs, I am using O2CO2. And I am preparing the foam with O2CO2, and then I can go up to between 15 to 25 mLs of foam, but always with O2CO2. If you need to change the concentration of the foam in one single patient, it's very easy. Once you have the foam, we can also prepare, I don't know, because of the time, maybe you can't have enough time. Maybe the next webinar will go direct to the demonstration. But what you can do is just to withdraw all the foam that you have in the capsule and take it out, and then restart the process. So you withdraw the capsule, you take this remaining foam out, and we can do something very quick right now. And then you change the concentration. This is a 0.7. Please, can you tell me if you see the? This would be an option. Yes. So you have the foam is being prepared with one concentration. This is a 0.7, I think. Okay. Now I'm going to show you that what you can do is to withdraw the foam and then change for another concentration, starting for the very beginning. A charla sobre verlo poi. Yes. Do you have any advantage with the clots? Okay. Regarding the clots, I have to say that glycerin 70%, no, glucose 70% with polydocanol is not working very good with the VARIXIO because the glucose is not very good to do foam. First. Second, I treat just to check. With glucose. I don't like to use glucose. I treat my nurse with glucose, but just to know if it's painful or not. I have to say, if you compare polydocanol or glucose is very painful. So then I don't do glucose. I'm not neither using the clacks because I have no laser, and then I'm using always foam with very low concentrations. What about
see a comment from Professor Peter Ballas saying 0.2% only for telangiectasis or for reticular around 3 to 5 millimeters diameter as well.
So I could read something regarding the dry cough. Is this question?
No, it's actually after changing the concentration of the foam
What?
a little bit up.
Have you ever need to change the phone in a single way? Yes,
Yeah,
of course.
underneath.
Yes, because for instance, when I am treating tributary, combining, imagine you or I am treating a great saphenous vein and I have to treat or complement the treatment with small veins. Of course, I change the concentration. I take out the remaining if there is foam with high concentration, and then I start again to prepare again a low concentrated foam. Regarding the 0.2% only for the or for reticular. And for reticular veins, if you visit my clinic, you would see that I am preparing foam by starting at 0.12, 0.15 until 3%. And then I adjust in every patient. For reticular vein or small tributaries, I can prepare 0.4% or 0.5. You can go to the app that I show you, the QR code, and then you see that it's very easy to adapt and to select the foam, the concentration that you desire. I'm changing the concentrations depending on the size of the vein. Compression 2 weeks is good. So also to manage patient. Yes, I agree, Gabriele. I agree. So the use of stocking is controversial. I know that there are people that they are using always, but it's not my case. I've been trying to do it, but I didn't see the real difference. Okay, yes. Okay, no, it's okay, it's okay. Okay, there's a value between clocks. No, I couldn't see the difference because I'm not using clocks, but my experience with people that they are using clocks or using glucose, I try to do it some glucose treatments in my clinic, but they're very painful. So dry cough. The dry cough is probably related to the volume. Dry cough is because of the volume. If you are injecting more than 15 mL, it's quite common to have dry cough. Yes. The glass syringes are allowed in Brazil. However, yes. What about, this is something related to the material. It's important to select syringes with low silicon content. And there are some brands with a high concentration of silicone, as B Brown, and then I would select other brands. We can let you know the details about the brands that we recommend. So STS, especially STS, is very likely to react to the plunge, the plastic plunge. So it's curious to see that STS is less stable than polidocanol. Correct, Gennaro. Okay. How many veins per session with 0.2? Yes. I would say my average number of sessions, you know, that is quite variable, the patterns of varicosities, but my average is 3 sessions. In 1 session, just for a small area, I can reduce it less than 50%. So maybe the remaining veins would be the 20, the 30%. But you know, this is quite difficult to say because of different types of varicosities. But I insist to my patient that I prefer to go slowly than to go very fast, to keep in mind to my patients about the expectations.
Thank you, Enric. Do we have any more questions? Or I think we did not miss any. I think we responded to all of them. Please let us know if you have any more questions. You can also, if you have any questions after the meeting, you can ask us directly. I will send you now 2 email addresses in the chat that you can send us an email. Any questions you have, just let us know. Please feel free to just drop us an email. Oh, I think we have one more question or one more comment.
Yes, it's okay. I think the general, you're right. You're right. This is something that, but you're right. But in my first visit, depending on depending on how spread are the veins and the amount, I would say it maybe would need 2 sessions, 3, 4, 7 sessions, or maybe I can say to my patients, maybe it's a 1-year treatment. I'm very sorry about technical problems.
We can send you the QR code for the dilution app. Yes.
Yes. I repeat the session in the same area, but at least 3 weeks have to pass, not before 3 weeks. Hillary, yes, ask the team.
Yes, thank you for joining. We will send you tomorrow the recording, and I'm sure we can have a discount code for our listeners here. Thank you everyone for joining. Thank you. And also a quick announcement. We will be back in January with our next webinar about the treatment of saphenous vein and large varicose veins. And we hope to see you there. Thank you, everyone. Have a great evening.
Bye-bye.
Thank you.
Bye.
Bye-bye.